Good afternoon, everyone. I want to bring everyone up to date on where we are with vaccinations. As of today, we've vaccinated 321,516 of our fellow Ohioans. I want to kind of recap what our goals have been on vaccination, and they remain. We knew going into this that at least at the beginning, we would have not enough vaccine, and this has turned out to be true. We have, of course, the two companies, Moderna and Pfizer, that have been shipped into Ohio, continue to be shipped into Ohio. We hope to get a third in the not too distant future, and we hope that the production from these two will also go up. But for now, we have a scarcity. And that's something that none of us like, but that's the world that we live in. Our goals have been really threefold and remain threefold. Number one, to save lives. Number two, to vaccinate our healthcare people who are at the front line, who are fighting for us every day and who are protecting us, and we need to protect them. And third will be getting our schools back in person, still with the goal of trying to do this by March 1st. So those are the essential goals. Let me talk for a moment about the first one, which is saving lives. We're doing this in several ways. We made a decision very, very early to put a real focus on our nursing homes. This is where we have seen over half of the deaths that we have seen in Ohio from COVID. So it certainly made sense to do that. We have some good news, and the news continues to be good. 85% of the nursing homes have now been visited by the pharmacy companies pursuant to our direction. And so in 85% of these homes now, people have had the opportunity to get the vaccine, both staff and the residents. The pharmacy companies will continue to finish that additional 18%, 15% to finish it up. And we've already seen, starting last week, the beginning of the second dose and the second visits. Now, we don't have the exact numbers as far as compliance or how many people are taking those. If you remember, we said what the pharmacy companies were telling us when we took it all together was about 80% of the residents were taking it and about 40% of the staff. Pharmacy companies tell us that anecdotally that those numbers, as they go back for the second time and give people a second opportunity to take the first vaccine, those numbers have gone up. So we are happy about that. We also, based on information that we were told today, it looks like we have about a little bit over 9% of the vaccinations of people in long-term care facilities in the nation as a whole. We have a lot of nursing homes. We have over 900. And so we have a large number, but these are good results, and we're happy about that. I do have specific numbers in regard to our two veterans homes. These are run by the state of Ohio for our veterans. One's in Georgetown and one in Sandusky. In Sandusky, they've gone back. Second visits have been made. Now 92% of the eligible veterans have been vaccinated. So we're very happy with that. 60% of the staff has been vaccinated. 60% of the staff agreed to be vaccinated. In Georgetown, again, same number, 92% of eligible veterans. However, the staff was lower there. That was 42%. So I just wanted to share that data. Saving lives. Nursing homes, and those over 65. We know that 87% of our deaths have come from those who are over the age of 65. So great progress with our nursing homes. We have other congregate care facilities. And I think that we have really drilled down on not only doing our nursing homes, not only doing our assisted living, but we have some very small congregate care facilities around the state of Ohio, and we are focusing on those as well. We announced that we would prioritize those over the age of 65. We will start, as we announced, we will start next week. Those those 80 years of age and older. Let me talk a little bit about that and give you some of the details and some of these things we talked about last week, but I do want to go through them again. But something new. Our hospitals have been vaccinating their medical personnel. We are telling the hospitals today that they need to finish that up. They need to finish it up by midnight on Sunday, because on Monday, they need to move then to vaccinate those older Ohioans who are 80 or older. If a hospital, for some reason, does not want to do that, then we will ask them we will get the vaccine back from them. But I think most of our hospitals will be in a position to make that switch and to move forward to vaccinate those who are 80 years of age or older. It's time to make that move. We want them to finish up this week. They can go into Sunday and do that, but we really need to move, and we need to move to this age group. We also, in addition to the hospitals, we have a total, counting hospitals, we have a total of about 800 providers who, beginning next week, will be making the vaccine available once they get it, making it available to those 80 years of age or older. So let me talk a little bit about how this rollout will occur. The 80 years of age and older group constitutes in Ohio about 420,000 people. As of now, it looks like we have not gotten our numbers for today, but we believe that the number of vaccines we will have for next week for that age group is about 100,000. So as you can see, this will take a while. Yesterday, the Ohio Department of Health held a webinar with Ohio's registered vaccine providers. Now, we have had, for some time, providers have been able to sign up. We have over 1,900 providers who we can pull from in the future, over 1,900. And that number certainly will go up as well as we look to other pharmacies as well. So for the first week, we have picked 800 to start this process. We've asked local health departments to partner with local emergency management agencies and the providers in their counties, and to hold press conferences or otherwise notify the media, and to do this either tomorrow or Thursday. And so what they will be telling everyone in their local area is the locations where those 80 years of age and older will be able to get the vaccine. Some of these may be walk-up clinics, others may take appointments. That will be up to each one of the providers. Now let me talk about how the rollout does occur. And a lot of this we don't control. We can designate where the vaccine is going, but the shipment, we don't control that. So the shipments start arriving in Ohio on Monday, Tuesday, and Wednesday. And that's the way it works every week. So it will not be known until this weekend, probably on Sunday, exactly which of the providers get it on what particular date. But each provider is going to determine whether they sign people up or how they do that. So again, to recap, on Wednesday, tomorrow, or Thursday, it'll be up to the local health department. They will hold a press conference or they'll do a news release, and they will list in the county the different places and how you contact those places where they will have the vaccine. So I want to assure everybody, 65 years of age and older will remain priority. We know it's going to take a while. We have in the 1B group about 2.2 million people. So we know that will, in fact, take a while. But we want to get the vaccines as quickly and efficiently in people's arms as we can, and that will be starting next week. Also on Thursday of this week, the Ohio Department of Health will post information on our coronavirus.ohio.gov website. This is where Ohioans can see what providers are being allocated vaccinations for the next week. Residents you'll be able to search by zip code. You'll be able to search by county to find the place closest to you. The website also provides contact information for each location, each one of the providers, and links where the residents can learn more from that particular provider. Again, each provider will handle their own scheduling. Now, it's important to note that our site, the state site, will only show what providers have been allocated vaccines. It will not update in real time. So providers may go through all the vaccine they have, and that information is not available on our website, but it will be, that information, of course, will be able to come from that individual provider. So it's critical to reach out to each provider to get the latest information on the availability of their vaccine allotment and how they want you to register or sign up for that. As in the coming weeks, as more vaccinations are made available and Phase 1B opens to more Ohioans, we will be adding more providers. And this will be entirely based upon the vaccine that we get. As I said, vaccines from the manufacturer usually deliver on Monday, Tuesday, and Wednesday for each week. We anticipate those providers that receive their vaccine on Monday, January 18th, will start distributing on Tuesday. Those that receive them on Tuesday will start distributing on Wednesday. Those who get them on Wednesday will start distributing them on Thursday. We have asked each of the providers, and they have told us that they will, to complete their vaccinations within 7 days. So they should be totally done. Some will be done in a day or 2 days, but at bare minimum, they must be done with that within that 7-day period of time. Let me again recap where we believe we are going from here. Again, we start next week, and again, it will start in some places be available on Tuesday, some on Wednesday, some on Thursday. They will kick off at different dates depending on when they get the vaccine. On the next week, on January 25th, the week of that, we anticipate vaccinations. We will open up to those 75 years of age and older. The following week, in all likelihood, will open to people 70 and older. And on February 8th, the vaccinations we hope to be available to those 65 years of age and older. When a new age range opens, that certainly does not mean that vaccinations will be completed for the previous age. We're just adding that. Again, it will take a number of weeks to distribute all the vaccines given the limited doses available. We also will move on January 25th, and we'll have more information about this in the future, available to those with severe congenital, developmental, or early onset medical disorders. We'll announce in the coming days how those individuals will be able to receive their vaccinations if they choose. We anticipate next week, as I said, we'll have about 100,000 doses. Again, that is for 420,000 people. So obviously everyone next week is not going to be able to get it. Our area agencies on aging have a 50-year history of providing information and coordinating services for older Ohioans and their families. while the area agencies on aging are not the ones putting the shots in the arms, they're not doing that, they're the ones to call. If you're over 65 and you have questions about the vaccines, you may have a transportation problem, they are there to as they are all the time, to be of help. The Aging Network's priority is to get our seniors the vaccine, and then they'll be there as well for those who need to follow up. For more information, you can visit www.aging.ohio.gov. That's www.aging.ohio.gov, or call 1-866-243-5678. That's 1-866-243-5678. We did get news this morning, as I'm sure you saw on the media, that the Trump administration has indicated a change, and it's frankly a welcome change, and that is they will free up the vaccines that have been held back. This gets a little complicated, but they have been holding back vaccines. When we made a decision, and it was the right decision, to focus early on, day one. In fact, we actually got started a couple of days earlier. They allowed us to start on our nursing homes. We have 900 and some nursing homes in the state. We have a lot of nursing homes. But one of the qualifications was that we had to bank, they had to hold back for us of our vaccinations for that first dosage. That was 353,925 that we basically, on paper, transferred to them, to the government. And that was a requirement to begin the nursing home program. And so that has worked well, but the indication, if I understand it correctly, that we received today, and I was just off a call with the vice president and other governors. I had to leave that call to jump on the press conference, but that will in the future be made available for us. So what the federal government is saying basically is we now have confidence enough in our production line coming out of the two manufacturing companies, the two pharmaceutical companies, that we will allow you to move forward on this, and they will go ahead and send the second doses of those. So we don't know the details. We don't know exactly when that is going to start, but that is good, and that will mean we will have the ability to not have to have these held back, but put them out into people's arms and start their protection. And again, that comes from the government's belief that they now have the supply chain is good enough, production is good enough that they don't have to hold those back. And so again, more details will be coming. It is in fact very, very, very good news. One more thing, and then I'll go to the Lieutenant Governor. I signed an order today. And I will just read it. As Governor of the State of Ohio and Commander-in-Chief of the Ohio National Guard, and pursuant to my authority to set forth in Ohio Revised Code Section 591929, I hereby authorize and order 580 Ohio National Guard soldiers and airmen from the following designated forces, and it's listed, to state active duty to perform training otherwise authorized under Title 32 of the United States Code. Those units and personnel ordered to duty herein will act pursuant to the orders issued on my behalf by the Adjutant General. So this is an activation of members of the National Guard to bring them up to the highest level that is needed, and to be available for use in Washington and in the state of Ohio, Washington, D.C., and the state of Ohio. Lieutenant Governor.
Thank you, Governor. I have two announcements today relative to the economy and part of the 2021 year of recovery. We've talked a lot about broadband and the challenges that many people, particularly in rural Ohio, have had not having access to high-speed internet. And there's a good announcement today that will affect a good part of Appalachia in Pike, Adams, and Scioto counties. This is one piece of the puzzle. We said that, solving this issue is going to take a lot of pieces to the puzzle. It's like a quilt. We put, one patch here and another patch here, and eventually we can build a map, getting everybody access to high-speed internet. And today's announcement is that Southern Ohio Communication Services, in collaboration with Jobs Ohio, Ohio Southeast Economic Development, and Pike County Economic Development and Community Development, that there's an expansion, a $3.8 million expansion to provide internet access across 64 miles and 1,300 residential and business customers in that part of the state. I want to make note of that. When you do the math on that, that's about 20 to 21 customers per mile. You can see why it's so difficult to have the number to cover this area, and that it takes a collaboration, and because the economics of this are so challenging. This is essential for many people in this area to have access to healthcare, education, and workforce opportunities. It obviously improves the quality of life, and as part of this investment, the Southern Ohio Communication Service received a $50,000 Jobs Ohio inclusion grant to help build this out and for the building and engineering costs of the project. So it will add 5 new jobs. It will expand internet, and this is just one example of the steps that are being taken to try to expand that in 2021, to be aggressive about that. Let me also discuss industry sector partnerships. Industry sector partnerships are where we take businesses who have this need for employees, have jobs, have good paying jobs, and partner them with the education community for training. A lot of times people that you buy training off the shelf, you go to your local educational institution, and it's not quite right. It isn't what the business needs to hire you. And this is creating those alignments so that business and educators can work closely together to train the people in their communities for the jobs that are being created in their communities. And this $2.5 million in grants are going to help expand existing partnerships and create new ones. We're announcing 12 of them today, and they are in the sectors of construction and healthcare, IT, manufacturing, and transportation. And this is very important. As you go around the state, you hear businesses say, hey, the school isn't exactly training people in the way that we need them. And the school is saying, hey, we need to hear from the private sector. This is building that partnership, in the end, helping the individual get the skills that they need. We have the Advanced Manufacturing Partnership was awarded one, Appalachia Ohio Manufacturers Coalition, the CEA Cleveland Builds Partnership, Central Ohio Manufacturing Partnership, Connexus Industry Sector Partnerships, Information Technology Accelerator Partnership, Lorain County Manufacturing Sector Partnership, Mahoning Valley Manufacturers Coalition, the Ohio IT Apprentice Collaborative, Raise the Bar Hancock County, the Workforce Connect Manufacturing Partnership, and the Workforce Partnership of Shelby County. So you see those are all around the state, and we're really trying to help build the workforce of the future. This is something the business community has long asked for. We worked early on with the Manufacturers Association to build this. And Governor, I know it's been said, you've said it at least 2 times today, and I know you won't mind if I say it one more time, because we want to make sure people understand that this 80-plus-year-old population that make up 420,000 people, that there will be 100,000 vaccines available for them next week. Not today, but next week. And tomorrow and Thursday, they're going to be able to find out the information that they need on how to contact and where to go for those. We appreciate the 800 providers that are prepared to do this, spread out all across the state. They mapped this, the team mapped this to make sure that it was inclusive, where everybody had an opportunity as close as we possibly could make it, geographically distributed around the state, and appreciate all of those folks being prepared to do this next week. Governor, I'll turn it back over to you.
Thank you. I think we're ready for questions.
Governor, your first question today is from Jeff Reddick at WSYX in Columbus.
Thanks, Jeff.
Hi, Governor. Good afternoon again. The CDC recommendation has now updated to include that anyone 65 or older should be able to get a vaccine for COVID as soon as possible. So if someone who's 65 or older goes and asks for a vaccination beginning on the 19th, will they be turned away, or would you consider expanding it to include 65-year-olds sooner?
We're starting at 80, and the reason we do that, we're trying to balance getting it out quickly, but also not causing people huge inconvenience. So when you just do the math, Jeff, if you just only look at those who are 80, and we know those who are 80 and above are the highest risk, the highest risk. So even this first week, we know that only a fourth of the people 80 years of age and older will be able to get vaccinated. So to dump everybody in that first week, I don't know that it accomplishes anything. We want to give, frankly, the people who are 80 and over a head start. I give them a week, but it's a tension. You want to try to get it out as quickly as you can, but you also want to target it as much as you can. And so we're going to, the goal, we're going to see how this first week goes, but the goal is going to be to continue to add 5 years and 5 years and 5 years till we get to 65. I'm glad the CDC said 65. We had said 65 some time ago, and we said, look, this is the group that we need to cover. And it's just a matter of math. It's a matter of where we're seeing the fatalities. So nursing homes, made great progress on the nursing homes, 85% done, 15% to go, and then they got to go back and do the second shots. But now we're moving to the people who are 80 and above. So next week, begin Tuesday, Wednesday, and Thursday, depending on which provider you're going to, people for 1 week, people 80 years of age and older will be the ones that we will be targeting. The next week after that, we'll add 5 years and 5 years and 5 years till we get down to 65.
Next question is from Kevin Landers at WBNS in Columbus.
Hello, Governor. Law enforcement sources are telling us about a planned protest at the State House on Sunday. What is your message to those who plan to protest, and what guarantees are you willing to make to ensure those who come down are safe and that structures in the downtown area will not be damaged?
Well, you heard my statement in regard to the Ohio National Guard. What I didn't say, and I meant to say it, but that is for activation from the 14th of January to the 21st. That can certainly be expanded or speeded up. But look, people have the right to protest. They do not have the right to be destructive. They do not have the right to hurt other people. So there will be enough people there from law enforcement and the National Guard. But people have every right to protest. They have every right to do it peacefully. We welcome them if they want to do that. Whatever they want to protest about. That's 365 days a year. People have a right to do that. First Amendment does not go on vacation. But we also saw what happened at the U.S. Capitol. And, we're very concerned.
Next question is from Danny Eldridge at Hannah News Service.
Hello, Governor. Just following up on that, can you talk about why 580 National Guard? How many will be going to Washington? How many in Ohio? How many in Columbus? And then without obviously, I know you're not going to go into details, but what are some of the goals that you have for them? And
Sure. The goal is peace. The goal is protection of property and the protection of people. Protection of people always is number one. That's the goal. We don't know the exact number that the federal government has requested or that will be going. Is probably in the neighborhood of 200 out of that group. But again, General Harris will confirm that. And I just talked to him just a few minutes ago, and he thinks are roughly around 200. We'll go to Washington, D.C. And again, this is not unusual. As you know, Ohio, I'm told by General Harris that Ohio sends members of the National Guard to inaugurations. This is a normal procedure.
Next question is from Marty Schladen at the Ohio Capitol Journal.
Marty.
Good afternoon, Governor.
Hey, Marty.
I typically hate long questions, but I've got a long-winded one for you.
Okay.
Last week, you said the problem behind the attempted insurrection at the Capitol is that so many people have lost faith in our institutions. But throughout his presidency, Donald Trump has relentlessly attacked the impartiality of the courts, the integrity of elections, and the legitimacy of a free press, with only mild rebukes from you. And at the same time, you supported his reelection. Trump fueled last week's putsch with a torrent of lies about a stolen election, and I don't recall you telling him to stop lying. In September, I asked if you condemned Trump's refusal to commit to a peaceful transition of power, and you said you don't condemn anything. Go ahead.
Yeah, Marty, I'm the governor of the state of Ohio, and I'm not trying to be a smart aleck, but you know, I got a lot to do here. We're focused on a pandemic. We're focused on making this the year of recovery in Ohio, and I don't think that it's my obligation to stand up every single time the president says something and refute that. I have made it very clear that I trust our institutions. I trust our Constitution, number one. And our framers set a procedure in place. I also trust our judicial system. Not perfect. Nothing is perfect in life. I'm a product of that. I was a prosecutor. It's a system that works. And so what I said throughout this is the president has the right to go into court. And I trust the court system. Don't always agree with every decision. I didn't when I was Attorney General, but it's the system. The system works. And our mechanism of electing a president and our peaceful transfer of power, you know, I've had no experience in my life of that peaceful transfer of power, of seeing that since I was a little kid, where it didn't work. So forgive me if I have, you know, assumed that what we have done for over 200 years, we're going to be able to do in this election. Obviously, I said something at some point when I, you know, said that former Vice President Biden, now President-elect Biden, was President-elect. The president didn't like that. So I've also said that, you know, the president's words the other day at the Capitol were not good at all. It was pouring basically gasoline on the fire, and he shouldn't have said it. But I cannot spend every day refuting what the president does or any president. And when Joe Biden is president, you know, when I disagree, you'll hear me say I disagree, but I'm not going to focus on that every single day.
Next question is from John Reed at Gongwer News Service.
Good afternoon, Governor. Is the state providing any guidance for these providers who are getting the vaccine next week on what to do if they have doses that are going to spoil and they don't have enough patients in line or enough appointments made? If there's something like that to prevent, you know, something that might not look good.
Sure. You know, they got a webinar. We're going back to make sure they saw the webinar, and those who did not sign up, that they get that. We have made it very clear that any provider in the state of Ohio who has any doses that they can't get in someone's arm, they need to They need to have a contingency plan, number one. They need to focus, if they can, on 1A or 1B. 1B includes anybody 65 and older. So I would not anticipate that, they will have a problem. Most of them are not getting large amounts. It's going to range 100, 200 doses for some, maybe some 300 doses, maybe some bigger institutions will be more. But most of them are going to be around the 100 to 200 range. And I believe that our 80-year-olds and over who want this vaccine will, be more than adequate to get rid of those vaccines. But no, we don't want anyone wasted. That's the last thing we want done. We made it very, very clear. And look, this is always a balance again. With 800 different providers around the state, it's a lot of different places. But we also didn't want we want everyone to be able to have access to these over time. They're not all going to have access next week, obviously, but we wanted them to be in communities. So they're in every county. What that means is nobody gets a whole lot. And so I think that the supply and demand is going to work. Lieutenant Governor, I see.
Yeah, thanks, Governor. It's a great question. The Ohio Department of Health, I've had it sitting here on my desk since last week because I got this question, has issued for all enrolled COVID-19 vaccination provider partners guidance on exactly what they should do in the case that they have additional vaccines. They have a series of steps that every provider is supposed to have in place in advance of receiving the vaccine to make sure, and has been, this guidance has been out there so that they know exactly what they're trying to do, identifying, as the governor mentioned, the 1A eligible individuals to administer them, and then the 1B if they cannot find a 1A partner and otherwise eligible adults. And this is supposed to be in place with every provider to make sure not a single dose is wasted. But the plan and the guidance is out there.
Next question is from Andy Chow at Ohio Public Radio and Television.
Andy.
Hi, Governor. We've talked a lot, and you've answered a lot of questions in the past couple of weeks about the infrastructure of distributing the vaccine on the state and local level. I'm wondering if you could talk a little bit more about how that system works, starting at the federal level, and are there ways it can be improved? I'm especially thinking of how you just said providers won't know until the day before whether they even get the vaccine. Are there any improvements that you think could be made on the federal level to help improve the infrastructure of it all?
Well, I think, Andy, we're not complaining, but there's always improvement. There's improvement what we do. There's improvement what the federal government does. It would be nice if we knew, for example, earlier than Sunday, who was going to get it on Monday, who was going to get it on Tuesday, and who's going to get it on Wednesday. I mean, that would be helpful if they could figure out how to do that. But I think more to the substance of it, the announcement that was made today is very welcome. And a little humor, this is something that apparently the Trump administration and the Biden incoming administration agree on. It sounds like it, at least. And that is that we can take these ones that they've been holding back to make sure that there was a second dose, which is very, very important. But now we're hearing the Trump administration and the upcoming Biden administration both have enough confidence in the supply chain. They've obviously done the math and figured it out that they will be able to release these. And this should be a very significant. This should allow us to move much quicker. Now, it was unclear to me on the call with the vice president, they talked about a change in 2 weeks. So I don't know whether that will occur before 2 weeks or not. But the indication I got was it was a two-week change. We don't have our numbers yet today, which is normal. We normally get them later in the afternoon. So whether there's any change in that, but that's big. I mean, that's important. That means we're going to be able to get a lot more people their shots earlier. And so that's a good thing.
Next question is from Farnoosh Miri at the Associated Press.
Hi, Governor. You mentioned you are activating 580 National Guard soldiers, and some of those will go to DC. But when there were unarmed protests over the summer following the killing of George Floyd, you activated nearly 1,200 soldiers to go both to Cleveland and Columbus. After last week's deadly insurrection, which you mentioned yourself, do you believe your administration and the state's law enforcement groups are prepared and are taking seriously what could take place this weekend? Or you think you should be doing more like other states that are closing the Capitol and the state houses?
Well, I haven't got to other things yet. So we're talking with the Senate President and the Speaker about other steps. So we're not done with steps. Look, I'm in contact with the mayors of our major cities. During the summer, we sent members of the National Guard when requested by mayors. If we're requested anytime, we'll evaluate the situation, but we're going to defer to the mayors. When the mayors tell me they need National Guard, in all likelihood, I'm going to send National Guard. So that's what happened this summer. And it came it didn't all come at once. It came at different periods of time. So we're fully prepared to activate more members of the National Guard. I talk on every day, and I won't go into all the details because it's a private conversation, but we talk on Tuesdays and Thursdays of every week with the mayors. And I had a conversation with them today about that. We've had other conversations. And so they know that if they need National Guard somewhere else, that, in their city, that we will send National Guard. Further, we are constantly, since this tragedy in Washington, we have been reviewing and continue to review, and I'm on conference calls with our intelligence people and with the National Guard, General Harris, as well as a colonel of the Ohio State Highway Patrol. So this is step one. I'm following the advice of General Harris as far as the number of National Guard at this point. Maybe more to come, we'll see.
Next question is from Matt Wright at WJW in Cleveland.
Hi, Governor. Many Browns fans are planning to travel to Kansas City for Sunday's game. With Missouri on Ohio's COVID travel advisory list, what do you advise fans planning to travel there? Should they self-quarantine for 14 days afterward?
Well, I'm going to leave this up to Bruce, but I would just say, look, here's the reality. We're on our own list, and so are they. So we're both high. Neither one of us, it's a list neither one of us wants to be on. So you need to be careful whether you're in Ohio or if you're traveling out there. I think that, as far as traveling, there is a risk to travel, but it is more important how you travel, what you do, than the mere act of traveling. That would be my layman's opinion about that. And, it depends on what you do, how you do it. Bruce?
Yes, Governor, thank you. And I think that the governor said it very, very well. What I would add to his comments is this. When we travel, we are stepping outside of our usual patterns of behavior, and we're stepping into environments that are unfamiliar to us. So when folks are traveling out of state to go to this major event, wonderful, very important event, that's the context. And even though I'm confident that they will be very careful and they will adhere to the safety measures that we've talked about, when they come back into Ohio, it really will be important for them to be responsible and take a 2-week period to adhere to quarantine guidance, to say, this really represented a time where I left my community, and I don't want to expose my community unnecessarily to added risk.
Next question is from Molly Martinez at Spectrum News.
Hi, Governor.
Molly.
As Jesse Balmert of the Cincinnati Enquirer reported last week, First Energy comprised more than 1/3 of the dark money funneled into a group supporting your campaign and likely helped your daughter's campaign as well. How much of this did you know, and how much did it influence your immediate signing of the plagued House Bill 6?
During the campaign, I think both candidates for governor were for the broad concept, at least, of nuclear energy. At least that's my recollection. I can't speak for Richard, but that was our position. And I've articulated this, consistently, I think, since that campaign and during the campaign. I think nuclear energy is important. I don't know why we would want to get rid of the nuclear plants we have. Number one, they employ people, but number two, they comprise 85 to 90% of the non-carbon generating energy in the state of Ohio. So I've always been in favor of that. As far as what I knew about independent expenditures, I knew it existed, but as far as you just cited a figure that constituted so much of, I don't know that. I don't doubt you've done the research, but I didn't know that.
Next question is from Randy Ludlow at the Columbus Dispatch.
And let me just again finish, as I've said many times before, it does not impact my position. My position is my position, and it's been well known. It's not like I hid my position. Very, very open about my position when I ran for governor about nuclear energy in the state of Ohio.
Good afternoon, Governor. Randy Ludlow with the Columbus Dispatch. How confident are you that you can ensure Ohioans that they will not see a replay of the U.S. Capitol at the Ohio State House? How much is that a real fear of yours, and you believe there will be sufficient force to repel any such storming?
Well, Randy, that's a very good question, and I think about it a lot. And the images of what we saw on TV and continue to see even more every night as we see different angles and different shots of it is seared in my memory forever and on my mind. And it's something that I think about a lot. And yes, I'm concerned. And, I have instructed Highway Patrol, National Guard, to be ready. So yes, I'm concerned about it. I mean, we're activating members of the National Guard, not just to go to Washington. We're activating them for here in Ohio. We're concerned. If you look at the more information we see, and this is what you're seeing, what's coming out, is who some of these people were and how well prepared they were. It's something that every American should be concerned about.
Next question is from Jim Province at the Toledo Blade.
Jim.
Hi again, Governor. The Blade is hearing from its readers in Michigan, and some of them get their health care from providers in Ohio. Are those who receive vaccines here required to be residents of Ohio, or is it based on the local doctor who's giving the shots?
One of the things that we saw when we first started giving shots, and we record this. I mean, you can pull up on our webpage and you see it. And we started seeing, people who were not residents of Ohio. And then you kind of thought about it for a minute and said, well, of course, if hospitals in Toledo, hospitals in Cincinnati, they're going to have people work outside. Hospital in Belmont County area, they're going to have people work outside in West Virginia, and so those are natural occurring things. So you're going to see those show up, and that will in fact happen.
Next question is from Ben Schwartz at WCPO in Cincinnati.
I will also say that I think we're probably seeing a lot of Ohioans getting vaccinated in Florida. So I don't know that, but at least some news accounts I've seen. So, you know.
Hi, Governor. Ben Schwartz with WCPO.
Hey, Ben.
I know you've been asked a lot about this today, but I am just wondering if you're able to touch on any intelligence you've received regarding this potential State House protest over the weekend, and if you do have any reason to believe that it could end up similar to the situation at the Capitol last week.
Well, Ben, that would certainly be our worst fear. You know, we don't want to see that. We know that there are people in this country who do want to do more than demonstrate, who want to do more than exercise their First Amendment rights. And we saw in Washington some fairly highly sophisticated individuals who had significant training. And the more, every day that goes on, you know, the worse that looks as far as what we know about how that occurred and the planning that went into it. Now, I'm basing what I'm saying right now on nothing more than what's out in the public domain. So I'm not disclosing anything that anyone has told me. I'm just what I've seen in reading your papers and watching TV. And so, look, this is a disturbing thing. We have people who, you know, for whatever reason, want to commit violence. And we cannot allow that, and we're not going to allow that.
Governor, next question is the last question for today, and it belongs to Scott Hallis at the Xenia Daily Gazette.
Hey, Scott.
Trying to. There you go. Sorry about that. Can you hear me?
I can hear you now, Scott. We got you now.
Sorry about that, Governor. How are you doing today?
All right.
So you vetoed Senate Bill 375, which would void the Director of Health order limiting county fairs to junior fairs and create an agricultural society working group. I've gotten a couple of calls and emails from some of our folks here in Greene County because we do have the longest running, you know, continuous fair, I think west of the Allegheny Mountains. They're concerned that they're asking, does this mean there's not going to be a fair? Or I guess can you know, why did you veto that, and what's the future of the fairs?
Yeah, it means that we have no idea where we're going to be as a state when our first fair kicks off this year. Now, just to recap for a moment, we went out of our way to try to keep fairs going. We gave them money. In addition to that, we said the priority should be the kids, and the priority should be our children who are in 4-H, FFA, the junior fair. And we provide money for them to do that. So, you know, and we tried to work this through. And some fairs did a phenomenal job. Some didn't do a phenomenal job, but many did. And they did a great job. It's my fervent hope that as a lover of fairs and someone who's had children in 4-H, 8 children in 4-H, a total of probably 30 years combined, one end to the other, that our fairs will open and will be completely open, and they can do the fair just as we normally see it. But I don't know where we will be with this virus. I don't know how many people we will have vaccinated by that point. And so this is something that, you know, I'll do everything I can to see fairs open, but I want it done, it has to be done in a safe way. Last time we worked very closely with the Speaker and the Senate President on the order, on how it was going to work out. I will do that again with the new Speaker and the new Senate President, and we will look at this as people who like fairs and want fairs, and not only like them, but know the value of fairs. So I am a very pro-fair person, but I cannot sign something that automatically knocks that out with other ramifications, and we don't know where we're going to be yet. So we hope that when the Greene County Fair comes around in the latter part of July, and other fairs, obviously before then, some after, that we'll be open, and moving forward. That's the goal. So, well, thank you all very much. And I guess we are to the end, and we look forward to being back in a few days. Thank you very much.